Welcome to This Explainer. Today, we're diving right into the anatomy of a perfect plan section in your SOAP notes and exactly how getting this right directly mitigates both patient and legal risks. Whether you're a frontline clinician, a medical coder, or a CDI specialist, mastering this section is completely non-negotiable. You see, the plan section isn't just some clinical to-do list. It's a legally binding record of your clinical judgment. Let's kick things off with a pretty stark question that every single clinician and coder needs to ask themselves on a daily basis. If you gave the absolute best advice in the room, but you didn't write it down, did it actually happen? Well, in the eyes of an auditor or a jury, the answer is a resounding no. Not a chance. Picture this real medical legal case. A 33-year-old woman actually sued her clinic after suffering a massive myocardial infarction. And why? Because the provider failed to document counseling her on her severe risk factors. She was obese, hypertensive, and a smoker with abnormal cholesterol. Years later, she presented to the ER with crushing chest pain, completely too late for thrombolytic therapy. Because the provider never documented counseling her on those risks, they were found negligent. To avoid disastrous outcomes like that, we are going to systematically dissect the 6 core elements of a comprehensive plan. We'll cover the medical legal stakes, the 6 plan elements, RX and non-RX modalities, consults and referrals, patient education and literacy, and finally, follow-up and red flags.
All right, Section 1, the medical legal stakes. Let's lay down the absolute golden rule of clinical documentation.
Here is the harsh reality of the courtroom. If you didn't write down the instructions, the warnings, or the education you gave your patient, you simply didn't provide them, period. Documenting patient education isn't just good practice. It is literally your primary defense in managing risk. Moving on to Section 2, the 6 plan elements. How do we actually build a note where absolutely nothing falls through the cracks? Think of a bulletproof plan as your roadmap for safe, ongoing care. It needs to hit these 6 specific elements. You need your additional diagnostic tests like labs or imaging. You need your consultations and referrals. Then, your therapeutic modalities, meaning both your meds and things like physical therapy. And you round it all out with health promotion, patient education, and highly precise follow-up instructions. Section 3, RX and non-RX modalities. Let's zoom in on therapeutic modalities, because this is an area that frequently trips up even seasoned providers. We really need to mentally separate our treatments into 2 distinct buckets. You've got the medications you prescribe, and then you have your non-pharmacological interventions, like the RICE protocol, physical therapy, or dietary changes. Documenting a restriction like a 2-gram sodium diet for a hypertensive patient is just as critical as documenting their actual blood pressure medication. When it comes to medications, an ambiguous order is a dangerous order. Just writing morphine 2 milligrams IV PRN leaves way too much open for dangerous misinterpretation. You have to include the specific frequency, like every 2 hours, and the exact indications, such as for mild pain. This establishes a rock-solid, safe framework for the nurses who are actually administering it. Proper prescription documentation absolutely requires the exact name, dose, route, frequency, and duration. By spelling out something explicitly, like by mouth twice a day for 10 days, you leave literally 0 room for fatal pharmacy or nursing errors. Ambiguity is entirely eliminated. All right, Section 4, consults and referrals. Beyond the treatments you provide in-house, simply writing refer to cardiology in a chart is just no longer legally or clinically sufficient. The crucial missing link here is establishing medical necessity. And this is absolutely critical for securing insurance authorization. If your documentation doesn't explicitly justify exactly why that cardiology consult is necessary, well, the referral gets denied and your patient's critical care is delayed. Section 5, patient education and literacy. This ties directly back to that medical legal lawsuit we discussed earlier. Education is never just a one-way street. The Department of Health and Human Services defines health literacy as a person's capacity to obtain, process, and understand basic health information. So when you hand over a printed pamphlet, it is your job to verify that the patient actually understands the material well enough to make an informed decision. So you've got to explicitly document the verbal counseling you gave, the specific handouts you provided, and most importantly, the patient's actual understanding of it all. If you tell a sedentary patient to start exercising, document the specific type and duration you recommended. And crucially, what if they refuse your recommendations? You document that noncompliance and you document that you fully explained the risks.
Finally, Section 6, Follow-up and Red Flags. We have reached the climax of patient safety. This is where you establish a safety net for when things don't go as planned.
Listen, a safe follow-up plan never ever just says return as needed. It outlines precise timeframes and very specific red flag symptoms. If you're treating otitis media, your note should read, follow up if not improved in 48 to 72 hours. It should explicitly list warning signs for rare complications like meningitis, such as a stiff neck, and it should tell them exactly when to rush straight to the ER. Which brings us right back to our golden rule. Failure to document your instructions is considered failure to provide those instructions. If your specific follow-up parameters and red flag warnings aren't in the chart, the law assumes you kept them a secret. Saying it on the way out the door is simply not enough. It has to be written down. So, take a really hard look at your clinical documentation practices. Ensure you're hitting all 6 elements, detailing your therapies, and locking in those specific follow-up parameters. If your SOAP note went to court tomorrow, would your plan defend you or condemn you? Please like, share, subscribe to Decode Healthcare with Harshal.